Most frequently, there are many contributory factors to constipation, and dehydration is foremost. Perhaps you have constipation or somebody you're taking care of. It's worthwhile to look through the underlying causes of dehydration that may be contributory. There are other videos that deal with a dietary balance that can affect constipation, how diseases can, and how medications and supplements affect constipation and can be used sometimes to alleviate it. It's not uncommon for multiple contributory factors to be the cause of constipation. In the winter months and air-conditioned summer months, we breathe dry air, and when we do this particularly overnight, as we respire out, the air is moist from our combustion. As we respire in, it's dry, we become constipated. Simply by putting a humidifier in our air system can alleviate this. Individuals who exercise over-vigorously, perhaps treadmill, perhaps running, 5-7 times a week, can easily have chronic constipation from chronic dehydration. If you drink fluid, including electrolytes, you can rehydrate your vascular space rapidly, but it can take several days for the membranes to rehydrate and moisture to return so you're not dehydrated on the membranes. It's very important to ask why a person's dehydrated. There's a large spectrum of disease processes that can contribute to dehydration. Sometimes it's important to go to your health practitioner, have a dialogue, perhaps a targeted physical exam and interview. Sometimes it's important to have a nutritional tune-up and then reassess why you're dehydrated. An undiagnosed fever can cause dehydration. If it's a simple virus spanning 72 hours, the solution is good hydration with fluids and acetaminophen to keep your fever under control. If it's an ear infection or an occult hidden infection, it's important to figure out what it is and treat it. In the case of urinary tract infections, there's increased urination and additional loss of fluids through the urinary tract. Also, in individuals, particularly the elderly, who get urinary tract infections, the infections can move into the bloodstream where dehydration and infection in the bloodstream results in urosepsis, which can be dangerous and difficult to manage. It's important to manage any fever with acetaminophen to lower the risks involved. Diet clearly can affect states of hydration. Some foods have a lot of water content, vegetables for instance. Other foods are very dehydrating. Foods that are processed tend to be more dehydrating. Protein supplements can be very constipating and dehydrating. Diet influences electrolyte balance. If a person is given IV fluids, for instance, they will regain their sodium, but it may be days, 2 or 3 days, before the tissues equilibrate with the water content. So fluid moves into the vascular space and over several more days into the tissue space. This is particularly true in somebody who has had diarrhea with potassium loss and replenishment with IV fluids. They may not find a state of good, adequate hydration for several days until after replenishment of fluids. Other videos from the Video Health Guide that you might be interested are medications and supplements used and avoided in constipation, disease processes affecting constipation, insight into dietary balance relative to constipation, and management of constipation. There are other videos on bloating and irritable bowel as well.